Doctor, I know you are in Chicago right now, but you've got your team on the ground in Gaza. What has the last week been like? What are they telling you? How scared are you for their safety?
Thank you for having me, Stephanie. The situation is beyond catastrophic. It's near impossible to describe what's going on right now in the hospitals in Gaza. I've been in contact with the lead doctor in Kamal Adwan Hospital, Dr. Hussam Abu Safiya, this morning through WhatsApp. And he told me that they are unable to evacuate the hospital. They received the order to evacuate the hospital. It's a pediatrics hospital, has about 170 patients. You had the children in the intensive care unit on ventilators, and you have newborn in incubators, and they don't have receiving end in southern Gaza. There's no enough beds to accommodate them, and it's impossible to transport them in this situation with the war, with the bombing, with the lack of resources, lack of ambulances, lack of diesel fuel. So even if hospitals wanted to evacuate to southern Israel, they will not be able to logistically. There's 3,000 patients right now in northern Gaza, and there's only 800 beds in southern Gaza that are all completely full. So the first rule when you evacuate patients, of course, is to have a receiving end, and there is no receiving end. Also, the sheer number of injuries that are receiving in the hospitals, the type of injuries, I've seen horrific pictures and images of children bleeding. They're all on the emergency room and the floor of the emergency room because there's not enough beds to accommodate them. On every exam table, there's 3 or 4 children screaming. Some of them are in complete shock. And there is complete chaos, which reminded me of what happened in Aleppo at the time of the siege of Aleppo in 2017. And what's happening in Ukraine? I just came back from Ukraine, and I witnessed the impact of the Russian bombing on Ukrainian villages and hospitals. And on top of that, you have a blockade of diesel fuel, of medicine, of medical supplies, of food. There is scarcity of resources, so physicians are trying to ration the use of gauze, of chest tubes, of suture kits, of everything, because they're not sure whether they will have that tomorrow. My organization, MedGlobal, has been trying to distribute medical supplies that we procured in the first few days to the hospitals. The amount of mental health trauma is unimaginable. We had COVID pandemic in Chicago and the rest of the U.S., and the impact on our medical staff in Chicago was terrible. You know, half of the nurses in my hospital quit because they were impacted of the number of patients who were very sick and and many of them were dying on us, especially in the first few days of the pandemic, few months of the pandemic. So this is happening in Gaza every minute. Every minute there's a large number of children who are injured, who are pulled from under the rubbles, and there's very limited things to do with them. And on top of that, then you have the uncertainty of what will happen tomorrow. Some of the physicians and the nurses lost their family members because of the bombing. Today, Dr. Fadi Al-Khudari in Shifa Hospital, he got to know that his father and his brother were killed in a bombing. And the fact that they are not sure whether they are themselves will be alive tomorrow or day after.
So what are those doctors inside those hospitals telling you? If this ground invasion from Israel is potentially imminent and they cannot evacuate, if there are children and incubators and ventilators and they're trapped there, what do they believe their fate will be?
Unfortunately, many of the children, even without the ground invasion, without electricity, then ventilators will stop working, the incubators will stop working, the operating rooms, the elevators in the hospitals, everything. All hospitals are dependent on electricity. I mean, we had similar situation after Hurricane Katrina, where hospitals lost electricity and they had to evacuate some of them. It took 4 days. With all the technology and the transportation system that we have here in New Orleans and in the United States. So imagine the situation in Gaza. Unfortunately, many patients will die, young children who are not responsible to what happened in Israel. And that's a huge tragedy. No one knows what will happen to them. Even if they decided to transport them with this limitation, many of them will die during the transportation itself.
I'm out of time, but I have to ask, what can you tell us about the water situation?
As far as I know, that the water is very limited in the buildings and the hospitals that we're supporting in northern Gaza. There is still water. I heard the news that the water was turned on today by Israel. I hope that this is the situation, but the situation is very fluid. Water is important for many things. The last thing that you want to have is an outbreak of some disease because of lack of clean water. That was the problem even before the war started. 95% of Gazans have no access to clean water before this war.